Hello and welcome again to BioNexus Health podcast series. I'm Dr. Jody A. DeShore. Today we have with us Aggie from New Jersey. Aggie has kindly agreed to share with us her journey with her wonderful, beautiful, bright and amazing daughter, Megan, through Lyme disease, other tick-borne infections, mold biotoxin illness. And it's a pleasure to have Aggie here with us today.
Welcome to the BioNexus Health Podcast with Dr. Jody A. DeShore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jody A. DeShore.
So let's start with the first question, if I may. Can you tell us a little bit about Megan's journey on with Lyme and co-infections? How did you find out that she had Lyme and co-infections? What did you try in the beginning? Were you aware of that mold might be playing a part in there? And last but not the least, what made you choose all natural herbal medicine approach?
Okay, if I forget anything, just remind me, because that's
yes, no, sorry. I know it's a lot of questions, but what happens is once people start, they actually cover everything. So it works best if I ask all the questions. So what happens is people know what's coming next. So
okay, so I guess the best picture I can give you of Megan is Energizer Bunny. If you remember that commercial from many years ago, just keeps going and going and going. And that's always been her, overachiever, A student, always trying to do better, didn't like to make mistakes. An athlete, pushed herself, played every sport as a child, every travel sport as a child, from basketball, soccer, softball, cheerleading, would leave one event to go to another, constantly go, 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 go. Like I said, she was my little Energizer Bunny. So fast forward 2013, she's a freshman in high school. I asked her to take the dog for a walk for me one day. I was busy with something. Took the dog for a walk. There's a dog park down the street, a little stream, some wooded area. Dog got loose. She had to go through the wooded area to get the dog back, because the dog, of course, was like, I'm free, not listening. A few days later, she asked me to look at something. She had something on her which she thought was a scab. It was right above her collarbone, and it was an engorged tick. Now, okay, I pulled it out best I could. I couldn't be sure if I got the head out. At that point, I didn't know about tick testing or anything. So the only knowledge I say I had to go on Lyme was whatever you could read on the internet. Oh, it has to be attached a certain amount of time and it would show a bullseye. None of that happened. No bullseye. I mean, it was a little red, but that could have been from me trying to dig the tick out. A couple days later, home sick from school with a fever, chills, achy, just kind of flu-like. And I'm reading stuff on the internet again. I'm thinking back to that tick. I'm like, it's too soon. It usually doesn't show that soon. I'm believing all the misinformation that's out there. And I thought, it has to be coincidence. To this day, I'm kicking myself for not pouncing on that. But as Megan said, the pediatrician we were seeing was very much a non-believer, so she wouldn't have done anything anyway.
Oh, I see. Okay. Well, so, yeah. Sorry. So that is, a few years ago, that seemed to be the norm. That's the experience I had as well. Like, lack of awareness was so rampant.
Yeah, I mean, I knew nothing about it. I just whatever I read on the internet, the CDC says this and Health Med says that, they were all pretty much in a line that, it had to be attached a certain amount of time. And to be honest, neither of us knew how long it had been there, but the fact was it was engorged. So that's got to tell you something. So she went back to school, went back to her sports. you know, typical overachiever, decided 2 weeks before lacrosse season she was going to play high school lacrosse. And we're like, you know, nothing about lacrosse. A lot of the girls on the team knew she was very fast. She was, you know, a very fluid runner. She looked like a gazelle, as one of my relatives said. Tries out for lacrosse, makes varsity in typical Megan fashion. Didn't know anything about the game. So she starts her sophomore year feeling a little tired, nothing out of the ordinary. By, I'm trying to think, July, it's the summer after her tick bite. She went for her physical. You know, we're looking at vaccines and everything. And her doctor, you know, recommended the meningitis vaccine.
Meningitis.
Right. So, I mean, it's typical. It's something you get twice. She had the first one. She'd never had an issue with vaccines before. Like, okay, you know, let's get that vaccine. Actually, no, that was the following summer. So she was keeping it pretty much in check, but feeling more tired than usual.
Right.
So this was after her sophomore year. She got that shot because she had to be 16 or 17.
I have a question. So Megan's always been very active and athletic.
Absolutely.
Right. So that seems to be a big advantage that I've seen in my practice clinically, that athletes in the beginning, they handle it quite well. Okay, go ahead. Go ahead.
All right. So once she got this vaccine, the flu-like symptoms started again. It's the middle of the summer. So we're like, you know, this is unusual. You don't usually come down with the flu in the summer. So we figured something viral, but again, the same thing she had seen after her tick bite, the aches, the chills, the fever for a couple of days. She recovers from that, but start of her junior year, something wasn't right. She was very tired all the time. She couldn't concentrate. She couldn't focus. She would come home from soccer practice and just pass out for 2 hours. Literally just go upstairs to bed and just sleep, and like had to wake her up like, Megan, you got to eat dinner. It's 8:15. You got to eat dinner. You got to do your homework. And this was never a problem before. She'd come home, she'd eat, she'd hit the books. You know, she was very methodical in how she did things. And this was going on for a couple of months. It was, you know, okay, tired the end of, you know, the year before, but figured it was from her schedule at playing club soccer. You know, she'd go to school, lacrosse, have a lacrosse game maybe. And the first year she was playing varsity and junior varsity. So that was 2 games back to back. And then she would come home, grab a bite, and go to club soccer practice. And she was working as a soccer referee on weekends. So, I mean, it's pretty normal to think, okay, this is why I'm tired.
Right.
But partway into her junior year, when she was just passing out after coming home, she came to me one day and said, I think I'm sick. So I said, okay, talk to me. Tell me what's going on. And, you know, we'll figure out what we can do about it. And she told me all her symptoms, that she's really, really tired all the time, that she has a hard time getting up. She can't focus. She can't concentrate. She blacks out sometimes. She'd be driving her car and forget where she's going, or where she was. Just a lot of, you know, little things that you would think, okay, this could be anything. And even when I went to school for her parent-teacher conferences, now she'd had the same history teacher for 3 years. I sat down with him, and the first thing he said to me was, is Megan okay? He picked up right away that something wasn't right. So if you figure a teacher seeing this, you know. So I took her to my doctor for testing, because if nothing else, my doctor is very thorough. I said, you know, this could be this. It could be chronic fatigue. It could be Hashimoto's, which runs in our family. And she did see have a lot of symptoms that I did see in myself prior to my diagnosis with Hashimoto's. So they did the usual run of testing. They tested Lyme, they tested Epstein-Barr, they tested, you know, full thyroid panel. Everything came back negative. The poor kid burst into tears in the doctor's office. And I said, look, just because this didn't show anything doesn't mean there's nothing wrong. I believe you. It just means we haven't found it yet.
Right.
So the doctor actually recommended IGeneX testing.
Okay.
Because it was one of those things where, you know, I knew nothing about it. I had never heard of IGeneX before. And I thought, well, this is silly. Why would I pay for something out of pocket when, you know, and I asked her, I said, look, what's the difference? And she said that standard lab tests are about 30% accurate. And IGeneX was about 90% accurate. So big expense to cover the full panel out of pocket. I said, let me think about it. I said, let's treat it as if it's Epstein-Barr, which doesn't always show up, and we'll see what happens. And I happen to be speaking to, my husband also agreed that we should wait on that. I happen to be speaking to another mom at her school. Her son was a classmate of Megan's, and she had Lyme. And I didn't know this at the time, and I was telling her they wanted her to try this different testing, this, you know, independent lab or something. And she said, that lab saved my life. And she told me that she also tested negative on everything. And anytime people were asking how she was doing, because she was missing a lot of school, and I told them what was going on, they would always say, has she been tested for Lyme? And about 6 people say that to me. And sure enough, once this woman told me, you know, that lab saved my life, I said, that's it, we're going IGeneX. So we did the full IGeneX panel, which came back positive for Lyme. 4 bands, but some of them were double starred, so it was considered CDC positive, and Bartonella, which I understand is quite an anomaly that it showed, Bartonella showed up on a test. So from there, she was treated by my doctor with 1 antibiotic. That didn't really do much. She had a lot of herxing in the beginning. I kept being told detox. I didn't know what detox meant. So I jumped on Facebook and joined the Lyme groups and learned a little bit about detox. Didn't even go that well. You know, she didn't want to do the Alka-Seltzer Gold, didn't like lemon juice or lemon water. You know, it was really a lot of trial and error trying to find something that either didn't make her feel sicker or that she would be willing to accept. So then I pushed for the Mthfr testing. And doctor's like, doesn't matter. I said, humor me, I'm paying for it. Fortunately, I have a good relationship with this doctor. So they did the test, and she did come back with multiple
SNPs, mutations.
Yeah.
Yeah.
Mutations. Thank you. That's what I was looking for. I was distracted by my dog who was trying to jump on the couch. So she did come back with multiple mutations, including the one that meant she didn't detox well.
Right.
With the herxing, the doctor cut her antibiotic dosage in half and never increased it. So I don't know if that had an effect, because here she wasn't getting the full dose of anything. There was no change. I mentioned it to the doctor, and she said, well, she's not following the diet. Now, you know what a picky eater Megan is.
Yes.
So it's like pulling teeth. It's like, you know, as she points out, she goes, well, what good is it going to do me to eat this stuff that's going to help me if I get sick by eating it? So that's an ongoing battle. So
that reminds me, Megan also has celiac, right?
Yes.
So she has celiac, so she had to be gluten-free.
Yeah, she was already gluten-free for a number of years before her tick bite.
I've seen that as a, you know, sort of an advantage in patients who are already on a gluten-free diet. Seems to be that the immune system gets a break.
Yeah.
You are already on a gluten-free diet. You mentioned the tremendous expense of private lab testing. That's what we had to go through as well. And unfortunately for us, we only saw band 41 IgG, that was it. But thankfully, once again, you know, another mom whose child had gone through PANS, PANDAS type issues, highly recommended that, you know, we don't disregard this and go see Dr. Jones. Actually, this other mom was also a pediatric oncologist, because we were trying to rule out, if there was any kind of cancer issues because obviously you want to know what's going on with your child with, I don't know, you would move heaven and earth to find out what's going on.
Oh, yes.
To help them. So that's.
Absolutely.
Yeah. Go ahead, sorry.
Okay, so yeah, the one antibiotic wasn't really doing much. So again, I pushed. I said, I see a lot of information that I've been reading says that generally it takes more than one. Right. As a cyst buster or something that gets through the biofilm, I'm reading a lot. I said through Horowitz about, attacking 3 different versions of it. And she said, or forms of it, excuse me. And she said, it's not time for that yet. I'm like, well, she was diagnosed in February and it's now June. So when, I didn't know there was a time frame, and there was really no logic to why we had to wait. I didn't understand that. And unfortunately, at the same time, Megan was still trying to play lacrosse, still trying to play soccer, and trying to get recruited by colleges to play soccer.
Oh, goodness.
So here we are, the poor kid's dying. She's on 1 antibiotic. She's not detoxing well. And we're dragging her around Florida for 2 weeks to do soccer showcases in 95-degree heat, South Florida. So that wasn't going real well. So she finally relented and put her on a 2nd antibiotic. Didn't really help. When the MTHFR test came back positive, showing she didn't detox well, she opted to pull her off everything. She stopped all antibiotics and said, you need to detox. And I said, look, what about mold? I'm reading a lot about mold, how that can be a factor. We did have a flood that destroyed half our house. I said, now, everything on the 1st floor was replaced, except for the beams and everything. Helping me clean stuff up. There could have been some mold, like I said, granted, we pulled everything out. And at that time we were unaware that shoddy reconstruction had led to mold elsewhere in the house. But
okay.
When I asked her about mold, that's when she just said, stop everything, detox, and you should go see Jody. So I can't say that we made a conscious effort to seek out natural treatment. We really didn't know anything about it, but I do know that the antibiotics were not working, whether it was the way they were prescribed or the ones that were prescribed or the dosage. I don't know. I will admit, I was very skeptical when they handed me your name on a piece of paper and it said OTR. I'm like, an occupational therapist. What is it? And I was a little confused. Like, she didn't explain anything about your background or anything. And I was just like, all right, I'll give it a shot. And at the same time, made another appointment with another Lyme litter doctor just in case. But I do know that when we first saw you, you did agree that she was in bad shape. She was almost bedridden. She could barely get out of bed to go to school. Literally, this was like the start of her senior year. I think her first visit with you was like 2 days before her 18th birthday. And she, I think, had been to school maybe 6 times at that point, and her birthday's in October. So she was in bad shape at that point. And you agreed that she was in bad shape. Obviously, you could just look at her. Through this previous doctor, you continued her on antibiotics for a few months, but pulsed. And it was a different antibiotic than she had been on. The second one was a different one than she had been on, and it specifically for the BART. The pulsing seemed to go much better for her because she could get that break. And then it seemed to kind of, pull everything out of hiding. And then when she hit it again for the next round, it felt like she was killing more off. So it was basically, we just kind of fell into herbal, but I was of the mindset that, the other stuff didn't work. So what have we got to lose? It couldn't be any worse. And I think what I liked about the herbal was the fact that you could fine tune your treatment Whereas antibiotics, you herx, you have a choice: keep going and keep herxing, or stop it for a few days. Where with herbs, if you felt there was an issue, or you felt like you were herxing or feeling worse, you could just dial it back a little. Like, okay, one less drop, or let's not increase them for a couple of days. And obviously, Megan goes very slowly on that. She's on a lot of stuff right now. And basically what I do is, here's the morning, here's the evening. I'll go up one thing in the morning and then something different in the evening, but only one drop a day. So, today it's evening and tomorrow it's morning, So, I mean, and that's worked for her. So it doesn't tax her system too much. As far as the mold, when I told you about our history and everything, boy, what a can of worms that opened.
Yes.
She did test positive for the mold gene, 2 of them, I believe. We did some more searching, and the bathroom reconstruction was done poorly. So that was leaking. Bathroom shares a wall with our family room. So that leaked right into our family room. Mm-hmm. Had to rip out a lot of carpeting, a floor, a closet, you name it. Did the mold remediation, really had to look really hard at her living arrangements for college, because being in a southeast humid city in, some old buildings for classes, there was a lot of issues there too that I think helped impede, despite all my best efforts here, every time she came home, it was massive cleanup all over again. I think everything that she brought home from college this time got the full cleanup. Throwing things away, moving like a lot of people do, is not an option for us. We still have a mortgage on our house. My husband's job is here. So, we can't just up and leave. And yeah, while I would do anything for her, I'm going to do anything in terms of cleaning, remodeling, air purifiers. And that worked. I mean, after you told me about the small particle remediation, I emptied her entire room, everything except the bed, because I can't move that. And literally HEPA-vaxxed, cleaned everything. Before anything went back in that room, it had to be vacuumed and cleaned, and ran the air purifiers nonstop. And she did feel better after that. So okay. Looks like I get to do it again thanks to her job.
Right. Yes. There are so many inadvertent re-exposures to mold. I want to comment on something you said earlier, pulsing of antibiotics. So one of my mentorships was with Dr. Joe Jemsek. He's a absolutely amazing Lyme doctor, Lyme specialist in DC. And pulsing antibiotics was, when I was studying with him, that's his methodology. So this way, when the primary care doctor is on board, I'm able to guide some patients, with Dr. Jones's protocols or Dr. Jemsek's protocols. Just overall, obviously, it doesn't replace their care, but not many people are able to wait that long or travel that far. So that's how I was able to give you that information about pulsing, and it does help. It had helped my son as well. The other thing you mentioned was small particle cleanup. That is important to do, because even for new construction homes, the construction crew leaves behind
dust
and debris, which can be
yeah, we had that with her dorm, her freshman year in college. It was brand new, so we're like, yay, no mold, right? We walked in there. We were down there for a week before our classes started, and we're still cleaning up construction dust every day.
Yes, that's something I had to do, that I advise my patients as well. In fact, there was one patient who looked at brand new construction with a full finished basement. And it was interesting because the photographs which they post online, right, on one of these realtor websites, it looked like absolutely picture perfect, beautifully finished basement. And then the photographs that she was sent by her realtor, which were more recent, there was, and actually I noticed that because, you know, Eva did not notice that, because there are so many things going on in purchase of a new house, you know. So one of the photographs in the basement that I noticed had a couple ceiling panels in the basement open. So that was very suspicious. So again, you know, long story short, she did Hertz testing, and Hertz testing came up sky high, 32, 36. Ooh. Basement was
higher than mine was.
Exactly. So she just ran out of that place pretty much.
Good.
Yeah. So thankfully I think she was able to get her deposit back because he's an attorney, and that kind of helped things along a little bit. But yes, that's what they do. Then there was another incident that I remember, that the house was okay, brand new construction, house was okay. She, of course, you know, would have to do the small particle cleanup. However, the numbers were coming up higher in the beginning because the house was staged.
Yeah.
It was the staging furniture, which is mostly stored in just, you know, maybe not climate controlled warehouses or water damaged warehouses and what have you, storage places.
Right.
So that's what it was. So once they removed the staging furniture, they did the small particle wipe down, then the mold numbers, the Hertz numbers were once more in check. So it's very...
I'm curious to see if my family room improved, because we got a new couch, and the old couch had been here when we flooded. It was still in this room. Only one small portion of it got wet because we literally used paint cans to prop everything up. But I said, between the dog laying in it all the time and the fact that it had been in here and whatever particles, I'm curious to see if it's improved since then. Or plus I cleaned it. Just maybe not as eagerly as I did Megan's room in the bathroom, because my arms were killing me by that point.
Oh, it is a tremendous amount of effort that one needs to put in.
Oh yeah.
For cleanup. So all in all, you know, all of these efforts, right? Herbal therapy, herbal medicines, supplements, gut support, detoxification, addressing the MTHFR, addressing the mold biotoxin illness, going after all different forms of Lyme. It was all done through an all natural herbal protocol. So Megan was able to go to college, and I hear she did very well academically.
Magna cum laude.
Awesome.
Like I said, still the overachiever.
Yeah, she made the dean's list like several times, almost
her school had quarters rather than semesters.
Okay.
So I mean, summer was a quarter, but there's no way she's going to stay in that heat hole because she's very much heat intolerant. So she did 3 quarters a year and made the dean's list every quarter except for one. And oddly enough, that one is the one that she did from home online, not COVID, but when she decided to take some time at home to work on her health for freshman year. So other than that, she made the dean's list every quarter. She had a perfect 4.0, a few of them. And now her big sister's trying to top her.
Oh, good old Megan. Yeah, it's been a privilege, you know, being able to help her and knowing her over the past few years. And she's doing well overall, right? There's always ups and downs and re-exposures, but
so she was get her out of that job.
Right, she was re-exposed again at work.
Yeah, very much so. I mean, like I said, I've been in that place, and just, you know, forget the basement where they store a lot of stuff, which she says, now, she's never been a big reactor. I know a lot of people talk about unmasking. after treatment. She's never been one that could walk in and immediately feel it. She walks in here and she can immediately smell it.
Mm.
She's like, it smells musty down there. I'm like, honey, must is mold. I said, if you smell it, it's there. You know, and gathering the stuff they need for their party packages. So that's one thing, but even the room that they keep it in. I walked in there to bring her food one night. I said, had anybody heard of this phenomenon called dusting? Because there was about 3 inches of dust on every surface in there.
Oh my
I'm like,
goodness.
honey, you need to bring a Swiffer. She's like, oh, they'll just disappear. I said, no. When you have some time, just Swiffer and throw it out and go wash your hands. Even with a mask on, she's feeling it. I mean, you saw it in her blood work.
Yes.
The week she started there, I think she had only been there for interview and for training. And for the first time ever, her C4A was through the roof.
Mm.
Now, she'd been in mold treatment for 5 years, 6 years, never had a high C4A. She hits this place and boom, through the roof.
Yes. It's very challenging to find clean workspaces, to find clean college dorms. Lots of youngsters in that same.
Yeah, I mean, we saw it in college. Like, she had the brand new dorm her freshman year. Sophomore year, she was in an apartment, and I just made sure, you know, we had the air filter in the living room. We had an air filter in her bedroom. We had small, like, desktop dehumidifiers. I don't know how good they are, but one in her bedroom, one in her bathroom. We had a large dehumidifier in her living room. I mean, I was doing everything to try and keep it down. She had no problems there. She was in that apartment for 2 years, and then her last year they decided, oh, the resident assistants need this apartment. We're going to move you down the hall. And when we walked in for her senior year, I unlocked that door. I walked in and I immediately smelled it and went, oh my God. I said, get the car emptied ASAP. I need to go to the storage unit and get all my cleaning supplies, the air purifier, the dehumidifier. And literally, I just went to work. We the first one's in. We checked every mattress looking for the cleanest one. HEPA-vac that, sprayed it, you know, before with thieves cleaner, before we put anything on it, let it dry a little bit. I literally was walking around spraying thieves cleaner on the walls. This was before I knew about the small particle remediation. HEPA-vac, ran the dehumidifiers everywhere. I mean, I cleaned every inch of that place. And the next day, my sister walked in and said, yeah, it smells better. I'm like, better isn't good. I want it gone. And then, of course, you remember the incident 3 days later when they had the burst pipe in the utility closet and flooding everywhere.
Yes, and then, and you had to get rid of the rugs and what?
Yeah, I mean, they came and cleaned it. Maintenance came and cleaned it for her. And I'm like, I don't trust them. Get rid of it. You know, and I said to Megan, it's up to you. You know, you can do what you want. If you want me to clean it again when I stop by, because we had gone to Florida. So we were stopping by on the way home. I said, if you want me to clean it again the right way, you know, with thieves, something else in there, I'll do that. If you just want to toss it and get a new rug, I'm fine with that too, because she had it for 3 years already anyway. It was. So we got her a new rug. And then when she came home, I cleaned it again thoroughly, and now it's in her bedroom.
Okay. When did she graduate? Last year, right?
2020, yeah.
Yeah. Okay. And she's held her own through the pandemic. She got herself a job, then she got exposed at the job. Now you guys are looking for a better option work-wise as well.
Well, she obviously does want to get a job in her field, but since the bulk of jobs there are in California, you know, that was so shut down that, you know, nobody was hiring. It's one of those fields where you could send 100 resumes before you hear from one company, and that's very discouraging for her.
Okay.
She needs to work on her portfolio because she is in, you know, an art field. Her portfolio does need an update, but she hasn't had time. And with this job that she's in right now, for only a few more days, thankfully, in addition to the mold, she does mostly, you know, she might work a little bit on Monday and Tuesday, but Thursday, Friday, Thursdays are day off. Friday, Saturday, Sunday, she could work 10 to 16 hours a day.
She's been working. Okay. Oh,
yeah.
Goodness. Okay.
The other day, she had to go in for a party. She was supposed to go in at 5 o'clock. It was an overnight party. So she was supposed to be working from 5 p.m. to 3 a.m. And then she got called in early. So she had to go from 4 p.m. to 3 a.m. Why?
Oh.
But then, of course, by the time she got home, it was almost 4 o'clock. I know this because I waited up for her.
4 a.m. in the morning.
Yeah.
Yes. And so, yeah, so looks like, sounds like her life is a bit hectic.
Yeah, no, her last day is Sunday, thankfully.
Okay.
Unfortunately, she's in the moldy facility today. I think she's in moldy tomorrow, and Sunday she's in the clean one. So.
Okay. So as we can see, there will always be ups and downs for those of us who have the susceptibility gene, and with respect to mold, with respect to Lyme, the HLA-DR susceptibility matters. The precautions are usually lifelong and in order to maintain health. And I'm just happy to hear that Megan has the strength, has the endurance and the tolerance that she's able to work for 12 to 16-hour days. That's just so crazy. But I'm glad that you guys are looking for better job options, cleaner spaces.
Yeah. She had a phone interview for one job, and she said they said in-person interviews were next. I think they were just trying to narrow down. She said if that falls through, she's just going to take time off.
Okay.
And get back to where she was, get her health back, get her mind back, because she's depressed. So
excellent decision. When it starts to impact neurotransmitters,
well, she's due for a physical, and I said I think we need to do neurotransmitter testing, and rather than just throw stuff at it and see what sticks, let's see where the actual issue is, and we can go from there.
Right. So I look forward to seeing the two of you at your next follow-up. I once again, thank you so much for being generous with your time and sharing Megan's story with us today.
Well, thanks for having me.
That brings us to the close of this podcast. Thank you for joining us, and I look forward to seeing you at our next podcast. Namaste.
Thank you for joining Master Herbalist Dr. Jody A. Dashaw, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.